the Pet Health and Happiness podcast from Bella+Duke, keeping you at the cutting edge of pet nutrition, behaviour and health with expert interviews, mythbusters and more to help your pet lead a healthier, happier life.
Hi everybody and welcome to this week's episode. My name's Rowan Sanderson and I'm the CNO, Chief Nutritional Officer here at Bella+Duke, and I'm with our good friend Dr. Brendan Clarke. Welcome Dr. Brendan.
Hi, great to be here.
Awesome. Thank you for joining us once again. In this week's episode, we are going to cover everything you need to know about caring for your senior dog. So before we jump in, there seems to be a little bit of a moving playing field on this, Dr. Brendan. What constitutes a senior dog?
So let's see, the parameters that we'd normally go by for across all breeds used to be 7 years old and above, we would call a senior dog. Many people get a bit upset about that because, you know, that's middle age for many. And us middle-agers don't really like to consider ourselves senior. So
You're all on your own there, dude.
So what we are looking at is really the changes that happen around that period of time. So for some breeds, you know, especially the big breeds, that's going to be younger. So even at 5, some people would consider some of the big mastiffs, the Irish wolfhounds, things like that, as being classed as senior. You know, you've got to be watching out for regular checks on the heart. You've got to be watching out for growths that may occur. So things like osteosarcoma and, you know, cancers like that. So getting regular checkups is really starting to become necessary at that age. For some of those little feisty Jack Russells that are going to live for 20 years, you know, you're not looking at them really changing until they're sort of 13, 14, and then we might consider them senior. So there's a big range in that.
Yeah, okay. So just to summarize, I guess, thumb rule previously used to be around 7, but ultimately the larger the breed, the tendency is for them to age metabolically a lot quicker than the much smaller breeds. And I think that plays out when you look at the stats, isn't it? Chihuahuas, Yorkshire Terriers, Jack Russells seem to be the longest lived. So there's no hard and fast rule. So cool. And I think we've got a great infographic which we're going to post explaining that. What are the extra considerations that people need to take? Or should we even say, what are the common symptoms of aging that we see in dogs?
I'm really glad you brought up that considerations, because actually a consideration is dental health. Okay. One of the biggest things that I would say ages a dog is poor dental health. So for some of those breeds, like the Yorkshire Terriers, the Chihuahuas, those side of things, if you haven't taken care of their teeth and they have got shocking mouths, the amount of age-related diseases that seem to be prevalent in those, so from the cancers, the organ issues, the issues with arthritis, general inflammation, they seem to really succumb. And, you know, a classic here is, you know, a well-documented issue with hearts. So for some of those, they have heart issues genetically, and they will end up with a valvular failure. Well, if you end up increasing bacterial numbers into the bloodstream as they get older, any turbulence around those valves can build up levels of infection. So endocarditis is really a serious disease that can be debilitating and actually even lead to fatality if left untreated. So, you know, that's the extreme end of not dealing with dental disease. So I think biggest consideration is age, and then straight after that, how bad are their teeth? And that's one of the beautiful things about raw food feeding, but we can come on to that.
So, oh, sorry, could I just interject on this? Because there's a really topical point, and I think you'd be interested to hear it, is Dr. and our listeners, Dr. Emily Stein of Primal Health in the US. I interviewed her at the Raw Roundup last year, or one of the Raw conferences, and she has linked so many diseases definitively with some really cool research to exactly your point, dental health. She's identified a specific bacteria, and in humans, I know we can't always look at what's happening in the human world and assume it's the same in the dogs. We never do that. What we do like to do is see if what's going on in the human world can give us potentially an insight that's worth exploring in our pets, which is a much more, shall we say, measured way to go about it. But she identified a specific bacteria which was linked exactly with that dental health in the mouths of dogs and also in humans, with a huge correlation with heart disease and with pancreatic cancers. So that's something we can touch on another time, but if people want to find out more about that, we'll put a link both to that interview and to the teeth product, which is a really cool prebiotic to kill those bacteria, just in the spirit of helping everybody to look after their dogs better.
Yeah.
Sorry, Dr. Brendan, so back. Considerations, age, teeth, what other things would you put out there?
Weight, I think, is another big one. Okay, so really looking after your dog's body condition score, massive influence on arthritis. And also, again, there are papers out there about if the dogs are overweight, their increased predisposition to certain cancers. So again, weight is a big consideration. Keep your dog trim. And I think we should put in a link to body condition scoring here, as we use those scores usually on scales of 1 to 5 or 1 to 9. Okay, and a little bit confusing there, but some people on the 1 to 5 scale start introducing half marks, so we end up doing they extended it out to 9 because some people don't like the halves, bit OCD. But ultimately, you should be looking for your dog's body shape to be starting at the head end, coming down to the chest. You should feel the ribs, and it should be like feeling the bones on the back of your hand, okay, out flat. And that's about ideal. So 3 or 5, depending on which scale you're on, but that's I'm going to use the 1 to 5 scale. So that would be a 3, okay? If you clench your fist and you've got your knuckles like this and you feel they're that ribby, okay, then that's a 1. So that's a really poor condition. They've got lack of muscle, lack of fat covering. And if you feel the palm of your hand, okay, then that is just like a 5, okay? So that's overweight in that sense. So having a little, that's a really easy gauge. So come down to just behind the forelimb, about a third of the way down the chest, have a feel along the rib line, and if you can feel the ribs in those fashions, that gives you a guide on the score. I think we have 80% of our dogs are at least this, if not this, okay, with the extra fat. And we don't like to see the, Labrador that looks like a coffee table waddling around the park and literally, the back is flat as because there's so much fat on it. That dog is suffering at that point.
This is such a good point, Dr. Brendan. I think so many people now are habituated to seeing overweight dogs. They are shocked when they see a Labrador at its working dog weight. A lot of these are working dogs, and people have just become super used to seeing basically what's now known as the Flabrador. And no wonder they've got increased hip dysplasia, arthritis, and all of the other obesity-linked issues when they are really prone to bloating and being overweight. They're more susceptible, I think, to some of the processed foods than many of the other breeds.
So very lastly on the body condition scoring, I will just say a couple of other things. As you come from the chest up to effectively, so the back end of the dog's at this side, what they should do is actually sweep up into the groin. They should actually come up from the chest in the majority of breeds and actually sweep up like that and actually be sucked in. So that's good muscle mass in their core. That's also lack of fat in the abdomen pushing down to create, a flat bottom is not what we want to be seeing. And then looking from above, they should have a slight dip from the chest into a waist before they come out to the pelvis. So if you look at all of those markers, that gives you a really good indication of their body condition score. And they should sweep up. They should have a waist. They should be able to just feel the ribs, a third of the way down the chest. Those are ideal markers. If you're on the overweight side, look at reducing the amounts that you're giving. Look at maybe giving things that satiate your dog more. And we'll talk in another podcast a little bit about welfare implications around that. But there are things that you can give which will take longer to digest, make your dog feel fuller for longer, and actually physiologically keep them enraptured about their food and feeding whilst, so they're not constantly looking for the next meal and overfeeding.
Brilliant, so Brendan. I kudos you. This is such a clear, concise explanation. Thank you. So let's just recap on that. So far, we're looking at some of the considerations for aging. Dental health is one of the most important. You're saying the next thing is obesity, and with obesity, we've got a body condition score. They should have a tapered waist, and they should sweep up towards the hips. And not have a flat bottom. Right. Can you just run us back very clearly through the body condition score, please? So as I understand it, is this 2 to 3 on the back of the hand?
Right. Okay. So an ideal, and I have to be clear because different vets will use the different scoring systems. So on a 1 to 5 scale, ideal is 3.
Okay.
On a 1 to 9 scale, the ideal is 5.
Yep.
And so when you're on the ideal, it should be the back of the hand feel. Okay.
Yep.
So you should be able to feel the ribs. Okay. With very little covering of fat, but there should be muscle between the bones of the ribs. So you imagine your finger bones effectively are the ribs that you would otherwise be feeling. Okay. And the muscle in between those is how the muscle of the chest wall should feel. Okay.
Yep.
You should absolutely see a waist after the chest cavity coming back to as they go over the abdomen and then out to the hips. You should see a waist, and actually from the side you should see them sweep up into the inguinal area, the groin area.
Yep.
Okay, after the chest. That would be an ideal.
Perfect. Thank you so much for clarifying that. That's the first time I've heard the hand used as a scoring method, and it's really easy. I mean, it is a classic thumb rule. So fabulous. So apart from the weight and teeth, what are other considerations for us, for anybody concerned about their aging dog?
So I think actually I'd like to consider there are some age changes that we see, and I think one thing to dispel the myths about is, just because maybe the coat is changing and you're seeing grey hairs appearing, doesn't necessarily mean, oh my God, that all of a sudden they're becoming really old and fragile.
Okay.
I think it's, let's dispel that one, because many people say, oh, they're becoming old before their time, they've gone grey around the muzzle, and there are indicators as to why that might be, but I think, it's far from a defined marker of age. So let's go back to something that is more important. And I think that's when we see cognitive dysfunction. So actually, this is something that's not recognized that much, but is actually really quite common. And that is that we are seeing many dogs walk into the surgery that aren't quite as with it, let's say. They're just forgetful. They may be stare into space. They may start to feed abnormally. They may become a little bit non-responsive to owners. and they've maybe emotionally changed, so they become more irritable in certain situations. And actually, we sort of put that all down into this cognitive dysfunction side, a little bit like Alzheimer's for people.
Yeah.
And I think, like those, there are lots of supplements that are now coming onto the market, things that are there to enhance the repair of the brain with L-carnitine, with essential fatty acids in there, all the way through to things to help improve the amounts of serotonin. That's a hormone within the brain that helps to calm them. All of those things that seem to help in those areas, as well as there are some medications to improve the oxygenation of the brain. And that can be really effective. So don't miss out on your dog maybe becoming a little bit more forgetful as they get older, and thinking that's it. You're just going to have to put up with it. There are things that you can do to help in those circumstances, and not necessarily always the drugs straight away. So supplements, improving the diet, massively improving the diet. And I think one of the big things across human medicine, as well as into canine medicine, is actually making sure you've got good fats within the diet in these circumstances. There's too many issues with oxidized fats, rancid fats, we call them, in so many foods that will say that they've got longevity, but actually, if they've got oils within them and you've opened the bag so readily, they can go off and become rancid fats. And that's not a good situation for the brain and spine, which is wrapped in those fats. They require those good fats to insulate the little wires of neurons, the little wires of the nerves carrying the electrical impulses. Those fats are so important for all of that mechanism to happen. And if you don't have good fats, those wires are just like bare wires waiting to short out rather than being insulated. So if you want to keep that working well.
So interesting you saying this. I mean, this is a particular area of fascination for me. There's a very famous human doctor in the US called Dr. Terry Wiles, who healed herself from MS by ultimately going on to the human equivalent of a raw diet, i.e. a paleo diet, and ensuring she had lots of essential, non-rancid, fresh fats in there. And I listened to her speak, actually, and she said people lose sight of the fact that 60% of the human brain is pretty much fat. So if we go on a low-fat diet, is there any wonder that people get depressed or ill? So that's a great point. Thank you for raising it. What else would you throw in there?
I think, so arthritis is probably another biggie for older dogs. The dogs are just getting a little bit stiffer, okay? And I think from a point of view of, we talked about obesity and the influence that will have. You weigh a rucksack that contains half your body weight onto your back and carry it around every day. You too will feel the effects on your limbs of carrying that extra weight. And actually that compounded day in, day out can have big effects on the wear and tear. So for dogs, arthritis is actually a wear and tear disease, okay? It is a chronic, that means a long-term issue of the joints just not working quite the way they should, not being lubricated enough, becoming inflamed, and sometimes wearing away the cartilage abnormally. Whereas other arthritis, so rheumatoid arthritis, is actually your immune system attacking the joint. And so humans often will succumb to rheumatoid arthritis more readily and therefore assume that it's the same for dogs. But actually, it's a wear and tear disease in dogs. So it's a sign of old age where things have been overused, used in the wrong way because of overweight bearing. And so certainly we talk the overuse side of things, certain breeds being used for agility type things or repetitive agility type things like fly ball. If not controlled and done appropriately in a club environment, where you've got people advising you on not overusing your dog and not doing it properly, then actually, repeating that sort of exercise can become a danger to your dog's joint health.
This is such a great point, Brendan. This is a really great point, and we've talked a lot about optimal exercise levels. More is not more. And I guess to add to the point you're making is that if that dog is then overweight and doing repetitive work, you've got the inflammation created by those, oxidized fats cascading through the body, and an increased rucksack of impact on those joints, plus repetition. It's a trilogy of trouble.
Yeah, absolutely. Couldn't have been put better. I think, from a point of view of not to be mistaken for at the other end of the scale, I see so many people asking this really important question. Do I restrict my breed which is predisposed to having arthritis? So some of the larger breeds that, Newfoundlands, Burmese mountain dogs, German Shepherds, do they restrict them as a young dog to try and maintain their joints for longer in life? And I say that's totally inappropriate. Actually, what you want those puppies to do is not to be forced through running alongside you riding a bike, or to be forced through you're a triathlete and you're thinking that you wanted a dog companion and you're going to try and make them run with you for the 26 miles, or doing the repetitive injury of sitting at the top of a hill with a tennis ball thrower thinking, I'm going to sit here and admire the view whilst I run my dog ragged after the tennis ball. Those are inappropriate exercises for a young dog. However, restricting them, sometimes even to crates, unbelievably, to try and stop them using their joints or even going upstairs, I think is also inappropriate. They need to develop strong bones, strong joints, strong ligaments. The only way they do that is the body puts those fibers under a degree of gentle stress to build strength within those areas. So it's really important, because so many people get this inadvertent advice from breeders and people that aren't necessarily thinking of the physiology of how the body builds. And so if we can get across right now, please, when you've got a young puppy, allow them to do an appropriate amount of physical exercise. Yes, take them out in the garden, let them go upstairs, let them, walk for an appropriate amount of time. Now, you want a defined appropriate amount of time, I would be saying easily you should be able to do 20 minutes without them worrying about being restricted on lead, etc. You should be able to do that amount of exercise without any problems. You should, if you're walking, be able to walk your dog for an hour with them being close to you, not necessarily restricted on lead, but that should be fine. If you find your dog is then tired, take a seat, do some close training, concentrate on building your bond with your dog, and then set off. Make sure you've got plenty of water with you, and you will not go far wrong with that level of exercise.
That's really good advice. Thank you, Brendan.